Today another topic, that is clinical laboratory communication. Okay. Do you have any idea about this? Any guess? Okay, communicating reports. Only reports. Suppose আমি তোমাদের একটা রিপোর্ট বললাম hemoglobin level is this much. Only this much is the. So first we will discuss this thing. What do you mean by communication? So I will discuss about the clinical laboratory communication, the importance of effective communication in clinical laboratories, what are the types of communication and the barriers of effective communication, and most important, that is interdisciplinary communication in healthcare, patient communication and informed consent, and lastly the emerging trends in laboratory communication. Okay, so communication is the basic element of human interactions that allows doctors to establish, maintain and improve contacts with others. Okay, so it is a process by which two or more people exchange ideas, facts, feelings or impressions in ways that each gains a common understanding of meaning, intent and use of a message. So increases communication in healthcare system lessens the medical errors and make a huge difference in positive patient outcomes. Okay. Now first thing is clinical laboratories serve as the diagnostic backbone of modern healthcare. What laboratories you have seen till now? Physiology and biochemistry lab you have seen. So in second prof you will visit your pathology, microbiology. Okay. So these laboratories serve as the diagnostic backbone of healthcare system. So from blood tests to microbiological cultures, accurate and timely results are essential for patient care. And effective communication within the laboratory ensures that the test orders are correctly interpreted, samples are processed promptly, and results are relayed accurately. Okay. So basically the clinical laboratory communication is based on this triangle and these points. First is your crucial nexus of accuracy and efficiency. Suppose a physician needs a blood transfusion for a patient and he will send blood group in the lab. Okay, he needs the blood group, so he send requisition from blood sample to the lab, but it will take time. But suppose if the physician communicates to the lab technician, so a well communication ensures that the technician will prioritizes this sample. Okay, physician will tell them I need this blood group immediately. Okay, so he will prioritizes this task. So that is the importance of communication. Okay, then second is your interdisciplinary collaboration. Okay, what do you mean by this interdisciplinary collaboration? So clinical laboratories do not work in isolation. They need to interact. They need to interact with the pharmacists, nurses, physicians, as well as administrative staff also. Okay. Suppose I am giving an example. A pathologist, when examining a pap smear, he finds some abnormal cell. Okay. So he will inform or communicate to the gynecologist, and gynecologist will take gynecologist will take immediate follow-up of the patient and early treatment will be started for the cervical cancer for the patient. So this is betterment of the patient. So the pathologist early communication helps for the patient care. Okay. The next point is your standardized protocols and reporting. Okay. So every clinical laboratory is having their standard operating procedures, SOPs. Okay. And this ensures the sample collection, sample processing, and analyzing. Okay. So well communication in the laboratory ensures that the lab technician can follow this standard operating procedure for correct analysis of the result. Okay. Then next is your technology and information flow. Now you know in the modern laboratories all having this sophisticated instruments. Okay. So this instrument, suppose a liver function test was done, a chemical analyzer analyzes the LFT values and it will automatically transmit it to the electronic health records of the patient. Okay. So what will happen? The physician sitting in his chamber, he will see the health record and access the values within minutes. Okay. So this is another type of communication we are taking in advanced technology. The next point is your quality control and troubleshooting. Now, every laboratory have to check their machines are properly working or not. Okay. So this is the quality control of any lab. Now suppose ELISA test for dengue was done. The laboratory technician has put all the samples in ELISA machine, but after seeing the results came that all the samples came positive or inconclusive. Now this is not supposed to. Okay. So he will communicate to the lab manager, lab in charge, microbiologist, and the manufacturer's support team. So everybody discuss the situation and diagnose that there is some reagent contamination, so that all the samples came positive. So this timely communication helps to correct the fault of the lab. This is not the fault of others, this is the fault of your lab, where you are not doing quality control every weekly. That's why you don't know the reagent is contaminated. Okay. Next, the patient-centric communication. In healthcare system, all of we are doing that, what to do, the patient care. Okay. So patient-centric communication is very important. Suppose you have to do fasting blood sugar. Okay. So you need to explain the patient how to fast and when to give the sample. Okay. So this patient-centric communication is also important. Now, when you go through this clinical laboratory communication, there will be some challenges also present. Okay. Any idea what can be the challenge? One challenge जो आप लोगों को भी फेस करना पड़ रहा होगा, जो बाहर से आए हैं, language. Yes. So in lab also different people are there, so language barriers will be present. And suppose there will be when there is shift change, suppose a morning shift technician will hand over the things to the night shift technician. So what he will do, he will do the proper handovers. Okay. Standardized protocols was there and he have to deliver his all the handovers through this proforma. Okay. So next thing, we have to understand the importance of effective communication in clinical laboratories. Now, imagine a scenario where a lab technician misinterprets a physician's order for blood test. The consequences could be direct incorrect diagnosis, delayed treatment, or even patient harm. Right? So, effective communication ensures that orders are clear, results are accurately reported, and patient safety remains the top priority. Okay? From the lab technician's viewpoint, understanding the context of each test request is crucial. Okay? So, clear communication channels with physicians and nurses prevent misunderstandings and reduce the risk of errors. Okay? Next is your interdisciplinary collaboration. In hospital setting, the clinical laboratories collaborate with various departments like radiology, pathology, and pharmacy. When analyzing blood samples, the lab communicates promptly with radiology to correlate findings from imaging studies. Okay? Suppose I am giving an example. A patient is suffering from chronic cough for more than 1 month. Okay? So, physician will send the sputum sample first to the microbiology department for detecting the TB bacilli. But it repeatedly came negative. Okay? But physician noticed that patient is deteriorating. So, he again think of whether it is another diagnosis or not. But when he sent the chest X-ray, the radiology department finds that suspecting it is a TB case, maybe a TB case. So it's not the only the microbiology or physician, it's a collaboration of radiology department here also. So whenever they met together for this case discussion, they found that only the sputum examination is not sufficient for this patient. So they advise for further investigation like CBNet, TrueNet for this patient and find out that the patient is really TB positive. Okay? So this is not only the one team, it's a teamwork. Okay? It's not the work of one department, it's a teamwork. Okay? Then reporting and interpretation. For example, a lab report is not just a collection of numbers as I have told. Okay? So it's a story. Effective communication ensures that results are not only accurate but also meaningful. Suppose you are giving a high potassium level to a patient, that means the patient may be suffering from kidney dysfunction or it may be a medication side effects. Okay? So lab reports should be concise yet informative. Next is your timeliness and turnaround. All of you know biopsy report takes time. Okay? So imagine waiting anxiously for biopsy results, and effective communication ensures timely reporting. Delays can lead to prolonged patient anxiety, altered treatment plans, or missed diagnosis. Okay? So lab in charge will track the turnaround times rigorously, and communication channels with the couriers, specimen collectors, and testing platforms are optimized. Suppose a patient is suffering from cardiac attack, myocardial infarction. So troponin level is very important. So the lab technician has to understand this importance. Okay. Now patient education and informed consent. Before any genetic counseling or genetic testing, patients need clear information about risks, benefits, and implications. Effective communication ensures informed consent and genetic counselors plays a vital role here. Okay, so lab professionals engage in patient education. They explain procedures, potential discomfort, and confidentiality. So a well-informed patient is more likely to comply with follow-up tests and treatment. अगर आप पेशेंट को अच्छे से समझाओगे तभी वो आपके ट्रीटमेंट पे फॉलो करेगा, राइट? Next is your technology and communication tools. So most of the hospitals having their electronic health records of the patient. Okay, so these secure messaging platforms facilitate communication. Lab results are accessible to authorized personnel instantly. Okay, so lab staff must adapt to evolving technology. Training on electronic health records, secure messaging, and data sharing ensures seamless communication across the healthcare ecosystem. Okay? So all of we have to know this system. Now, what are the types of communication in clinical settings? Okay. First is your verbal communication. Okay, that is face-to-face interaction. What I am face-to-face interaction in clinical laboratories frequently occur between laboratory technicians, pathologists, microbiologists, or other healthcare staff. Okay, regular meetings and face-to-face conversation. Another verbal communication like shift handovers, as I have told earlier. Okay, night shift technician will hand over properly to the morning shift and vice versa. Okay. Then next is your written communication. Lab में written communication क्या होता है? Your lab reports. Okay. So lab reports should be clear, concise and informative. Okay. कभी आप लोगों ने कोई lab report देखा है? All of you have seen, I think. So every reports, when they give the results, they also mention the reference also, right? Reference. And at in the bottom of the report, have you noticed there is some note they have written? So this note is that the information is clear and concise, and patient have to understand this report. Okay. So that is your written communication. नेक्स्ट इज योर नॉन वर्बल कम्युनिकेशन. नॉन वर्बल कम्युनिकेशन क्या हो सकता है? सपोज हम लैब टेक्नीशियन, पैथोलॉजिस्ट और माइक्रोबायोलॉजिस्ट सब मिलके एक स्लाइड देख रहे हैं. ओके, व्हाइल एग्जामिनिंग स्लाइड्स किसी ने आईब्रो ऐसे रेज किया. ओके, सो दैट मीन्स दिस स्लाइड नीड्स मोर अटेंशन. ओके, सो दिस टाइप ऑफ कम्युनिकेशन इज ऑल्सो प्रेजेंट इन द क्लिनिकल लैबोरेटरी. ये यूजुअली जब आप लोग वायरल लैब में काम करोगे तब आपको प्रैक्टिकली समझ में आएगा. ओके, तब आप बात नहीं कर सकते हो बिकॉज यू आर इक्विप्ड विथ पर्सनल प्रोटेक्टिव इक्विपमेंट. सो आप किसी के साथ डायरेक्टली इंटरेक्ट नहीं कर सकते हो. सो दिस नॉन वर्बल कम्युनिकेशन इज वेरी इंपॉर्टेंट इन दैट सिचुएशन. Next is your interdisciplinary communication. Okay, so that is verbal communication, written communication I have discussed, non-verbal communication, and next is your interdisciplinary communication. So that is again the regular meetings involving the pathologist, radiologist, clinicians and nurses foster this collaboration. Like tumor board meetings brings together the experts to discuss the cancer treatment, right? So each specialist contributes their insights, leading to better patient management. Okay? Next is your emergency communication. Suppose a patient is admitted in the ICU after operation and lab technician finds that his hemoglobin level is very low. So he immediately calls the ICU nurse so that blood transfusion can be given to that patient. So this is the emergency communication, right? Then patient communication, I have already told. Before doing any test like fasting glucose, you have to communicate the patient what he have to do before giving blood. Okay. Now next point is your barriers of effective communication. So one I have told, the language and jargon. So clinical laboratories involve professionals from diverse backgrounds, each using specialized terminology. Misunderstandings can occur due to differences in language proficiency or jargon. Okay? For example, a medical technologist might use the hemolysis to describe damaged red blood cells, while a clinician may not recognize the term. Okay? So, bridging this gap requires clear communication and defining the terms during interactions. Okay? Then hierarchical structures. Hierarchies exist within clinical laboratories also, with pathologists, technologists, and supportive staff. Communication may be hampered due to power dynamics. A junior technologist hesitates to question a senior pathologist. This is a common situation, okay? So we have to encourage open dialogue across level, and which fosters collaboration and reduce these barriers. Okay? Then next is your technology challenges. Like laboratories rely on various systems for data exchange nowadays. So technical glitches or incompatible platforms disrupt communication. Suppose a lab result failed to transmit to the electronic health record due to system integration issues. Okay. So regular system maintenance, training and seamless integration are essential to overcome this challenge. Next, time constraints. Sometimes we need to give the reports very urgently. Okay. But this urgency often characterizes the rushed interactions, leads to incomplete information exchange. कभी कभार हड़बड़ी में गलती होने के chances भी हो जाते हैं, right? Like a nurse quickly requests a stat lab test without providing relevant clinical context. मुझे पता ही नहीं है कि पेशेंट का क्या डायग्नोसिस है, क्या है, मैंने जल्दी जल्दी में रिपोर्ट डिस्पैच कर दिया. Okay? So we have to allocating time for thorough communication, which improves accuracy. हमें accuracy भी देखना चाहिए. Okay? Next, interdisciplinary collaboration. I have repeatedly telling this thing, okay? Labs interact with clinicians, nurses, and administrative staff, and these silos hinder the cross-disciplinary understanding. Suppose a lab report lacks context because the technologist is not aware of the patient's overall condition. Okay? So this thing can be overcome by regular interdisciplinary meetings and shared protocols which enhance collaboration. Next is emotional barriers. Stress, workload and personal issues also affect communication. आज मेरा दिन अच्छा नहीं है तो मैं बात नहीं करूंगी किसी के साथ, right? So this will also hamper. So what we'll have to do? Encouraging empathy. So these are the barriers of effective communication. Next is interdisciplinary communication in healthcare involves the professionals from various domains, physicians, nurses, pharmacists, lab technicians, social workers, and more others. Each brings a unique perspective, skill set, and knowledge base. Okay? Physicians, ये practically होता है, okay? What I am telling this, practically ऐसा ही होता है. Physicians rarely interacted with laboratory staff and nurses, seldom collaborated with the radiologist. So, however, this fragmented approach lead to inefficiencies and compromised patient safety. So, ऐसा नहीं होना चाहिए, हमें team work के साथ करना चाहिए, okay? So imagine a scenario where a lab technician identifies an abnormal result in patient's blood work. Effective interdisciplinary communication ensures that this information promptly reaches to the treating physician, allowing timely adjustments to the treatment plan. Okay. Now, regular interprofessional meetings help in this situation. Scheduled gatherings where team members discuss cases, share their insights, and address challenges. Tumor board meeting brings together the oncologists, surgeons, radiologists, pathologists to collaboratively plan the cancer treatment. कौन से स्टेज में है, कैसे उसको ट्रीट करना चाहिए, ये सब रेगुलर मीटिंग से वो लोग डिसाइड करते हैं. Okay? Then shared electronic health records, a unified digital platform which allows real-time access to patient data. When a nurse updates medication administration, the pharmacist immediately sees what he needs. Okay. Then education, workshops on effective communication, cultural competence, and conflict resolution empower professionals to bridge gaps. Okay. This case example, like Mrs. Patel, a 65-year-old diabetic, presents with chest pain. The cardiologist orders for echocardiogram. The radiology technician, after performing the test, notices an incidental finding, a suspicious lung nodule. Okay. So instead of merely documenting this thing, he informs to the radiologist, and radiologist communicates to the pulmonologist, and Mrs. Patel receives timely follow-up and her lung cancer is detected early. Okay. So this thing all describes the what interdisciplinary communication means. Okay. Now patient communication and informed consent. Okay. Effective communication between healthcare providers and patients is essential for several reasons. First and foremost is understanding. पेशेंट को समझना चाहिए कि उसके साथ कौन सा ट्रीटमेंट हम करने वाले हैं, उसको क्या दवाई मिलने वाला है. Okay? So patients needs to understand their medical conditions, treatment options, and potential risk. Clear communication ensures that patients are well informed. Okay? Next, trust is built through transparent and empathetic communication. Believe me, 80% disease cured when your patient trusts you. Right? So patients who trust their healthcare providers are more likely to adhere to treatment plans. And when patients understand their health status, they can actively participate in decision making. Okay? Like a patient diagnosed with a chronic illness like cancer last stage. Okay? So the physician takes time to explain the condition and the side effects of radiotherapy and chemotherapy also. Okay? So the patient can himself decide whether he has to take the treatment or not. Okay? So we have to explain to the patient everything. Next is your informed consent. Okay, the consent part you will learn in your forensic medicine. Okay, this is very important part in healthcare profession. Okay, informed consent is a legal and ethical concept that requires healthcare providers to obtain permission from patients before performing medical procedures or treatments. Healthcare providers must provide relevant information about the procedure, risk, benefits, and alternatives. Okay? So consent must be given voluntarily, and patients must have the capacity to make decisions. Okay? Not under the influence of any drugs or mental impairment. Okay? There are different types of consent, verbal or written consent. So you will learn in forensic medicine. Okay? Next is cultural competence. Healthcare providers must recognize the cultural differences in communication styles, beliefs, and expectations. So treating each patient as an individual rather than assuming based on cultural background. So effective patient communication and informed consent are cornerstones of quality healthcare. By understanding diverse perspectives, respecting autonomy and fostering trust, healthcare professionals can enhance patient outcomes and satisfaction. Next is your quality control and communication. I have given this example before, the ELISA of dengue. Okay. So quality control ensures that laboratory results are precise and accurate. It involves monitoring and validating the performance of instruments, reagents, and processes. Okay. So laboratories use internal controls and external controls to validate test accuracy, and these controls help detect any shifts or trends in performance. So every laboratory has to check their instruments are properly working or not. Okay, so that is the quality control in simple for you. So quality control में क्या communication channels होते हैं? Like regular team meetings encourage collaboration, address the challenges, and share best practices. These gatherings allow staff to discuss quality control issues, troubleshoot problems, and learn from each other. Utilizing secure messaging apps or intranet platforms ensures the real-time communication. Lab professionals can share urgent updates, protocol changes, or safety alerts. So clear communication between lab personnel and clinicians or pathologists is crucial. When reporting critical results, the lab must convey urgency and relevant clinical context. Okay? Then sample collection staff know the proper labeling, handling, and transport of specimen depend on effective communication between the collection staff and the lab. So lab को समझ मतलब जो कलेक्टिंग स्टाफ होते हैं उनको अच्छे से समझना चाहिए कि स्पेसिमेन को कैसे हैंडल करें, कैसे उसको ट्रांसपोर्ट करें. Okay, this is very important. Then labs rely on IT systems for data management. Communication with IT teams ensures smooth functioning of the laboratory information system. Okay. आजकल modern sophisticated labs में सब में this LIC is present, laboratory information system. So जो lab में काम करते हैं उनको भी समझना चाहिए कि ये system कैसे काम करता है. Okay. So labs must promptly communicate critical results to the clinicians by this system. So when results require patient action like fasting for a glucose test, clear instructions are also essential. Okay. Now lastly, the last part is your emerging trends in laboratory communication. Okay. First is your digital transformation and interoperability. The adoption of digital technologies has revolutionized laboratory communication. From electronic health records to laboratory information system, seamless data exchange is essential. Okay. Nowadays, we need very fast reporting. So these systems are helpful, very helpful. Okay. So laboratories are increasingly integrating their system to enable real-time sharing of test results, patient histories, and treatment plans. Next is your telepathology and remote consultations. Okay. Telepathology influences digital imaging and telecommunications to facilitate remote consultations between pathologists and referring physicians. Okay. This is very important, telepathology nowadays. Okay. Pathologists can review slides, images, and tissue samples remotely, reducing the turnaround times and enhancing collaboration. Suppose a rural clinic sends a biopsy slide to a central lab. Okay. For evaluation, the pathologist located miles away reviews the slide digitally and provides a diagnosis within hours. Okay. So this is very much helpful. Then next is your artificial intelligence and decision support. Artificial intelligence algorithms analyze the vast database, aiding in diagnosis, risk prediction, and treatment recommendations. So laboratories use AI to flag abnormal results, suggest additional tests, and identify the trends. Okay. So after this, my take home messages will be, you have to know, first thing is your, what do you mean by communication? Okay. Next is your importance of clinical laboratory communication. Okay. Then types of communication, you know, verbal, written, non-verbal, interdisciplinary communication, patient communication. Okay. Then there are some barriers of communication. You have to tell these barriers like language, okay, shift handovers, and other barriers I have already discussed. Then interdisciplinary communication, what I have repeatedly told you, that it's a teamwork, okay. And lastly, the patient communication is very important. When you treat a patient should know everything about his disease or his treatment plan, okay.